Good morning, students. In the today's class, let us continue anti-neoplastic agents. The second classification is anti-metabolites. These are the analogues related to normal components of the DNA or of coenzymes involved in nucleic acid synthesis. They competitively inhibit utilization of the normal substrate or gets themselves incorporated, forming dysfunctional macromolecules. That means there will be competition between the normal substrate and the anti-metabolites, and this anti-metabolites gets themselves incorporated, which leads to dysfunctional macromolecules. Coming to classification of antimetabolites, antimetabolites are again subdivided into three classes, that is pyrimidine analogues. Examples are 5-fluorouracil, floxuridine and citarabine. Coming to second subclass, it is purine analog. Examples are 6-mercaptopurine, 6-thioguanine. Coming to third subclasses, folic acids analog. Examples are methotrexate and azothioprine. Coming to mercaptopurine, it is a purine analog. Uses of this is, it is used primarily for treating acute leukemia. The higher proportion of children respond more comparing to adults. Coming to mechanism of action, 6-mercaptopurine is an antagonist to purine. It serves as a specific replacement for hypoxanthine and thereby interfere with number of metabolic pathways. Coming to synthesis, 6-mercaptopurine can be synthesized by the two methods. First method is a single step reaction from purine 6-ol. When purine 6-ol is treated with phosphorus pentasulfide, gives rise to 6-mercaptopurine. Second method is from 6-chloropyrimidine 4,5-diamine. 6-chloropyrimidine 4,5-diamine is treated with potassium hydrogen sulfide. There will be loss of potassium chloride, leads to 6-thiol 4,5-diamine pyrimidine. When this is treated with concentrated formic acid followed by reduction, leads to 6-mercaptopurine. Coming to thioguanine, it is used in treating acute leukemia in combination with citarabine. Coming to toxic effect, it causes delayed bone marrow depression, which results in leukopenia and thrombocytopenia and bleeding. Coming to mechanism of action, thioguanine is actually incorporated into the DNA of a normal and the cancerous cell. This is the structural difference between mercaptopurine and thioguanine, which can be differentiated by using black color pen. Next classification is folic acids analog. Pyrimidine analog. Example is 5-fluorouracil. Uses of this drug is, it is most active drug available for colorectal cancers. It is effective in the management of breast, colon, pancreas, rectal and the stomach cancer. Coming to mechanism of action, 5-fluorouracil inhibits thymidylate synthase, a key enzyme in biosynthesis of DNA. Floxuridine is a prodrug of 5-fluorouracil. Coming to citarabine, it is used for acute leukemia. acute lymphocytic and chronic lymphocytic leukemia, meningeal leukemia, and chronic myelocytic leukemia. In this image, we can see the structural difference of pyrimidine analogs, that is 5-fluorouracil, floxuridine and citarabine. Coming to last subclassification, it is folic acid analogs. Examples are methotrexate and azothioprine. Coming to methotrexate. Methotrexate can be synthesized in a single step reaction from pyrimidine 2,4,5,6 tetraamine. When pyrimidine 2,4,5,6 tetraamine is treated with 2,3-dibromopropanol and methylamine benzoyl glutamate in the presence of barium chloride, water, sodium hydroxide, iodine and potassium iodide, and the pH should be maintained to 3.1, methotrexate is formed. Coming to uses of methotrexate, it is used for the treatment of acute lymphocytic leukemia, acute lymphoblastic leukemia, breast cancer, epidermoid cancer of the head, neck and lungs cancer, and it is also used against severe disabling psoriasis. Coming to mechanism of action, it inhibits DHFR, that is dihydrofolate reductase, and blocks the conversion of dihydrofolic acid to tetrahydrofolic acid. This coenzymes is required for the de novo purine synthesis. It is an essential coenzyme required for the de novo purine synthesis. Coming to next drug, it is azothioprine. It is used as a immunosuppressant. From today's class, what we understood is antimetabolites or the structural analogues of the normal substrate, and there will be competition between the normal substrate and the antimetabolites, and themselves gets incorporated, leads to dysfunctional macromolecules.